Hi, good afternoon.
Hello.
Okay. And so I hope you guys are doing well today. My name is Madeni, and I'm one of the MAs here. The doctor wanted me to go ahead and talk to you and provide you with some information on asthma.
Okay.
And this booklet here that would help explain what to expect and how we can manage your child's condition. I'll go over some key points with you, and if you have any questions, feel free to ask anytime.
Okay, awesome. Can I see the booklet?
Yeah, of course. So here, it is.
Okay.
Has all the details on asthma.
Okay. Cool. Thanks. I'm just trying to understand everything a little better. Is asthma something that can go away, or are we gonna have to manage this for a long time?
Yeah, no, good question. And I understand that can feel overwhelming. For some children, asthma symptoms may improve or even disappear as they get older, especially during adolescence.
Okay.
In fact, about 25 to 50% of kids with asthma experience a reduction in symptoms as they grow. However, asthma can also be a lifelong condition for some individuals. It really depends on the severity and how well asthma is managed. And then, so how has your child been feeling lately? Have you noticed any changes in their breathing or symptoms?
Yeah, actually I have. There's been quite a few times when we've had trouble breathing, especially after playing outside or when we get upset. I'm really not sure what to do when it happens.
Oh, okay. I can completely understand how alarming that can be. It sounds like your child may be experiencing some asthma triggers such as physical activity or emotional distress, which are quite common. In those moments, it's important to have a plan in place. And so, like having a rescue inhaler will help ease their breathing. We can go over how and when to use it, and I can show you a proper technique with this sample here. Would that be helpful?
Yeah, that'd be really helpful.
Perfect. And so the good news is once we identify what triggers your child's asthma, we can work together to minimize certain exposures.
Okay. Yeah, I noticed that when my child runs around or gets upset, their breathing seems to worsen. I've noticed it a few times, especially after playing outside when it's cold.
Okay, yeah, thank you for sharing that. It sounds like cold air might be one of the triggers for your child, and we might certainly work on strategies for avoiding those whenever possible. So,
Okay.
for example, taking the inhaler medication 15 minutes prior to any activity. It is also important to encourage your child to take breaks during physical activity, and if they start feeling winded, and you could keep a scarf or a face mask handy to help warm the air they breathe in. How does that sound so far?
That sounds like it could help, yeah.
Okay, perfect. And so now, in terms of managing the condition, it is helpful to know about the medications we can use. So some kids benefit from a quick relief inhaler like this here, which we call a bronchodilator. This is used during an asthma attack to open the airways and help your child breathe easier. You could also discuss long-term control options with the doctor if needed, which can prevent the symptoms from getting worse. Now, would you like me to show you how to properly use this inhaler?
Yeah, that would be really helpful. I'm a little bit nervous about getting it right.
Okay, yeah, no worries. So let me go ahead and sit down here. And so, of course, patient, I will have you go ahead and watch so that way you guys can both understand.
Okay.
So with this inhaler here, this is important that you take it at least twice a day, 2 puffs twice a day.
Okay.
And then, like I mentioned, especially 15 minutes prior before any physical activity.
Okay.
So with this inhaler, it's a puff dispense. So you want to go ahead and remove the mouthpiece, and you can see from the top, this is the dial where it will show you how many puffs you have left.
Oh.
And so if you do get into this yellow section, that will definitely let you know that you need to refill the inhaler. And so when it comes to taking the medication, you want to make sure that you want to shake the inhaler before you use it. And then you want to place this mouthpiece in your mouth. And then once you're ready, you just press down. And then you take a long, gradual breath in and hold it for 10 seconds.
Okay.
And then you breathe out. And then you do that same process for the second time.
Okay.
Okay, and then, let's see here. Is there any questions?
You know, that's really helpful. I didn't know how to do that, so thank you.
Okay, perfect. And so yeah, you're doing great. So remember, it's perfectly okay to practice this a few times before you use it in an emergency.
Okay.
The more comfortable you feel, the more confident that you will when your child needs it. And so yeah.
Yeah, thank you. That helps a lot.
Perfect. So I'm so glad I could help. I'm always here if you need any guidance or have any further questions. Would it be all right if I check in with you after a week to see how things are going with the inhaler or with any triggers?
Yeah, that'd be great. Thank you.
Okay, perfect. And so, of course, you're very welcome. Take care, and please don't hesitate to reach out if anything comes up. You're doing an excellent job helping your child manage their asthma.
Thanks. Have a good day.
Yes, of course. Bye.